Welcome to Health Empowered, the podcast where I dive into all things health, physical, mental, emotional, and spiritual. I'm Adriana, a trauma-informed physiotherapist and yoga teacher. On this podcast, I'll be interviewing experts in their health fields and humans living through healthcare experiences to provide you, the listener, with education and heartfelt stories. Let's learn together. I am excited to welcome to the podcast Leah Peterson, who is a physiotherapist. Leah completed her Bachelor of Science in Kinesiology from the University of Calgary and her Master's of Science in Physical Therapy from the University of Alberta. While she specializes in dance physiotherapy, she treats a variety of populations and has an interest in hypermobility, complex conditions, dizziness and vestibular rehab, and chronic pain. Leah is currently working at Indepth Physiotherapy as the clinic manager and lead physio. Indepth Physio prides itself on providing treatment options for those who don't fit into the typical physiotherapy treatment model, and Leah utilizes Clinical Pilates to promote that movement is medicine and individualizes each appointment to her patient's goals and activity tolerance in a one-to-one setting. She really emphasizes patient education and works to create patient autonomy in each session. And in today's podcast episode, we talk a lot about Clinical Pilates and Indepth's Clinical Pilates specifically. We talk about the difference in Clinical Pilates compared to regular Pilates and the benefits that you can see from participating in Clinical Pilates. I hope that you learn a lot today. I did, and I'm excited for you to listen and hear Leah's talk. Let's get to the show.
Hello, Leah. Welcome to the Health Empowered podcast.
Hello. Thanks for having me. I'm excited to be here.
Thank you so much for coming on. I am so excited to chat with another physiotherapist once again. Always a pleasure to chat about different physio topics. And with you today, we're going to talk a lot about Pilates because that's what you use a lot in your practice. So thanks for coming on.
Yeah, excited to talk about Pilates and chronic pain and all the good stuff that comes with it.
Amazing. To get started today, I would love if you could share your journey of why you became a physio and why you decided to specifically focus on Clinical Pilates.
Yeah, for sure. So I was sort of one of those people who always knew I was going to be a physio. Like, it was just one of those things. I think it's because I started going to physio myself when I was about 8 years old. I was super tall, super hypermobile. I was a dancer, athlete, and had all of these different injuries. So I had a pretty good patient perspective of what physio was and kind of knew what I liked and didn't like. And then I've worked at a few different clinics before getting into physio school and just got that patient exposure and got to help people. And I'm sure, as you would agree, it's like your love of helping people and that rewarding sense of like helping them achieve their goals and live their life. Like, that's truly what I love to do. So physio was always an easy choice. And then in terms of Clinical Pilates, that sort of came a little later. So a couple years into a working career when I met my current boss and colleague, Dani West out of Indepth Physio. She was already using Pilates in her practice as a physio. And once I got to see just how smoothly it integrated into the patient populations we were seeing, I was like, okay, I have to do this. So I got my classical Pilates certification through Embodied Pilates, which was in Canmore at the time with Bonnie Lynn Russell. And then Dani West and I continued to work on like a clinical application for it. And it's honestly just changed how I practice. So I'm so glad that I did it. Yeah, it's been so great to use. I work with a lot of dancers, obviously. So Pilates is sort of a natural progression from that. But also how it's changed how I work with chronic pain patients, people who are fearful of movement. And just sort of a novel way to reintroduce movement into their life. I think it's been really powerful for that.
Amazing. So much good information already with that. What would you say are the differences, or are there any differences between, like, if you were to go to a rec center, you were to go to a Pilates class, what's the difference in that versus the Clinical Pilates that you instruct people with?
Yeah, so good question. So I guess breaking it down, maybe what Clinical Pilates is first, and we can go into how it's different after. But
sure.
Clinical Pilates, for how we use it at sort of an Indepth Physio, it's physiophied Pilates. It's basically the easiest way to think of it. It's a movement system utilizing Pilates equipment. So We use 4 main pieces of equipment. For those who are familiar with it, there's the Cadillac or the tower, which are pretty comparable, the reformer, the Wanda chair, and then the mat. We also have some smaller little devices around the clinic, but those are sort of our main 4. And like I said, it's a movement system. So if you find a theme that the patient is struggling with or a goal you want to work on, and they can't do it on one piece of equipment, you have the option to workshop it on another piece of equipment to help them achieve that same movement goal. But the purpose of Indepth Clinical Pilates, specifically what we do, is to standardize the use of sort of Pilates in clinical practice. And so we even utilize a assessment framework on the Cadillac, so you can get the patient moving on day 1. So yeah, you still would you run through your usual stuff, rule out the red flags, your subjective, all the things you need to know to make sure they're safe. But it's a very active approach to movement. And so yeah, I think that getting people moving, that assessment and treatment all on day 1, it's just a really cool way to get a functional assessment of how they move. And then we use sort of the mat work more so as home exercises or things they can work on at home. So when they come back for their next session, they'll actually see differences on the equipment. They're like, oh, that was easier. Or, oh, I couldn't do that last day. And so it kind of helps create a win for them to be like, oh, I can do this now. So yeah, clinical Pilates, the simplest way, physio-fied Pilates. I think that's probably the simplest way to think of it. And so in terms of, I guess, the differences of going to a rec center class, there are some wonderful Pilates teachers out there who don't do clinical Pilates, so I don't want to generalize by any means, but for the clinical Pilates purpose, we're assessing and treating, where generally speaking, a Pilates workout is for exercise for the general population who doesn't have any limitations, any restrictions. They're able to go to their class, do whatever, and they leave and life is great. Where clinical Pilates is, we break it down, for the patients who have pain or mobility restrictions or weight-bearing restrictions, or they can't move as a quote-unquote normal class would need. Clinical Pilates allows sort of an entry point for all patients, regardless of their function, ability, age, any of that. So I feel like that's probably the main difference. Yeah, main difference is there.
Yeah, amazing. I imagine too, because if you're working in a clinical setting, it's often one-on-one, right? Versus when you're going to a class, regardless of, for people that don't know, and you probably know better than I do, because I've actually never taken a reformer Pilates class. I've only done a mat Pilates class. So there is kind of different types of Pilates. Maybe you can touch on that a bit too. But if you're doing clinical Pilates, you're working one-on-one. So it's a lot easier to assess and treat and see the differences and work with people's individual injuries versus if you're somebody going to a class, there might be 7 or 8 of you and the teacher can't unfortunately take that one-on-one time to dive into your injuries.
Yeah, exactly. I'm so glad you brought that up too. So yeah, we are very much a one-on-one clinic. We do have the option for occasional duos or trios. We'll have husband and wives come in for so we have some seniors who come in as their little outing with their partner, which is great. But yeah, generally speaking, one-on-one, individualized, you get specific cues that would work for you, where yeah, in a class setting, again, even though it's a great way to get a workout in, not every cue is going to work for every person. Not every movement is going to work for every person. So group classes are good if you already know how to get that movement base in. But yeah, the clinical Pilates, the one-on-one is going to help make it individualized for that person.
Mm-hmm.
And I guess I should also mention too, since you mentioned it, the different types of Pilates.
Yeah.
We won't dive too much into it, but I guess, like I mentioned, I'm certified in classical Pilates, which is sort of how Joseph Pilates meant it to be taught. It's from him. And then there's some different contemporary type of Pilates, which I've had it described as a game of telephone. It's pretty much the same essence, but there's little spin-offs and little variations. So similar movements, similar themes, but maybe minor differences here and there. So we utilize classical Pilates-based movements in our clinical Pilates assessments and treatments. And depending on the classes, depending where you go, you could get classical or get contemporary. Again, both have their benefits. So there's not that one that's better. It's just a difference.
Thank you so much for clarifying that. Yeah, there's probably people who think of Pilates and then just think of one certain thing. So it's nice to know that there's different variations of it. Mm-hmm. When you are using Pilates, was there something specific that when Pilates originated, they thought this is what it's going to be used for? Do you know that answer?
Yeah. So Joseph Pilates was a German man. he originally made this for like the German military. Like I think it was like a POW camp. He was training like men with Pilates. So I think it's honestly, people assume Pilates is really like feminine. It's only for dancers. It's only for really flexible people. And it's like, no, like they were using the springs from the cots in the military, like this for the equipment when it started. Like it was very much strengthening. It was very big on like whole body connection. There's breathing, and like the springs are meant to like replicate the lungs. And like when you inhale, the springs open, and when you exhale, they close. So there's a lot of like whole bodied, really juicy stuff that goes into it. So yeah, the purpose of it was not just for dancers, not just for, you know, necessarily a certain population. I guess in a certain way, it was maybe more for the able-bodied in that sense at the time, but there's so many things that, especially Joseph Pilates did with different types of clients. So I think it really evolved just pretty quick, and he had a pretty interesting, seems understanding of like the body as a whole.
Very interesting. I actually saw a video on Instagram the other day. It was a reel of like a soccer team, a men's soccer team, trying a reformer Pilates class, and like, it's so funny. They were just struggling so much, and they were like, this is the hardest thing I've ever done. And these men play like, you know, 90 minutes of soccer. Yeah. They have a whole bunch of training. So it was really, it was hilarious to see the video.
Well, and that I've seen so many of those too. And people like now send them to me being like, is this how bad it is? Like, I'm like, no. But no, it's super cool how it's getting to, there's so much more knowledge about it now, and it's way more common. So yeah, my dancers go for it for sure, but our clinic is getting more of actually we get a lot of soccer players, hockey players, runners looking for cross training. So I know I've talked a bit about how Clinical Pilates breaks down the basics and gets people moving, but there's also like the other end of the extreme where it's like, okay, take your high level movers who don't have anything wrong with them per se. You can still tease out different movement patterns and different sort of things to work on that you wouldn't necessarily get in a regular assessment, if you want to call it that. So yeah, I feel like it's getting a little bit more recognition for the male population, the sport population as well. But I think it's important to know literally anyone can do it, and you don't have to be as typically able-bodied as everyone else.
Amazing. That's awesome to hear that it can be so versatile.
Mm-hmm.
Yeah, what are the typical conditions that you use it for? You've mentioned that you have a lot of dancers that you use it for. You mentioned chronic pain. Is there anything else, or do you want to elaborate on how you use it for those populations?
Yeah, for sure. So I sort of started working out of school as like a dance physio just because of my injury background and dance background, which is lovely. And so I did start with largely a dancer population, and Pilates is an obvious connection to dance, especially with the flexibility, control through range, the choreography. Dancers tend to really gravitate to it. And I know I mentioned the high-level movers. It's a different way to add challenge or cross-training. But I really think it's important that people know the other people like help, because the most common thing that people say to me is they're not strong enough for Pilates. They're not flexible enough for Pilates. And I think it holds a lot of people back from actually starting Pilates. So this is a great question. So the people I've helped, honestly, the easiest way to say, I've seen all kinds of patients. Everybody can do Pilates. Anyone can do Pilates. So I've used it with, not at Indepth, we don't see MVA WCB, but at a previous clinic I was working at, patients who are suffering with a work injury or car accident, patients who have like a laundry list of issues, right? They come in, they're like, hey, I've had back pain, knee pain, shoulder pain, chronic headaches. And in a classical physio assessment, you could spend so much time going through each little physio test we know to like, okay, what I have to assess this, where Clinical Pilates gets you moving, can actually get a functional assessment of all of those areas in a different way. So I find it super, super helpful for chronic conditions or multiple conditions in a patient, because Pilates is truly very, very whole-bodied. That's the whole purpose of it. The other thing I find is really helpful is people who have a fear of movement, which tends to happen after you've had an injury, right? Your body goes into that protection mechanism and they're like, okay, every time I bend forward to touch my toes, it's going to be a problem. But Pilates is kind of sneaky, and I love it this way. For those who are really like hyper vigilant on their symptoms or over focused on their symptoms, Pilates can trick the nervous system, if you want to think of it that way, because the movements are so novel. They're not, the body doesn't know them. So there's a couple exercises that come to mind where you're essentially bending forward to touch your toes, but there's almost a distraction of the spring or the movement or how you're set up that we've had patients who can't touch their toes, but can do the motion that mimics touching their toes. And so when you can make that connection for them, it's like this light bulb moment, and it's really cool to see of like, you can have that whole pain education discussion, and it's an awesome feeling for them to be able to do that. So yeah, the fear of movement or the hypervigilant people who worry about their symptoms, I find it's so beneficial for. And then I guess on the opposite end of that are the people who struggle with connecting to their body with chronic pain. Because I don't know if you've probably seen both extremes of that yourself.
Yes.
But people who like can't like describe their pain, they like, I don't know what I feel. I just like, they can't quite figure that out. So because of that whole body connection of Pilates, you can reconnect them to their body, but kind of retraining their nervous system as you do it. So yeah, the chronic pain, whether you're on one end of the spectrum or the other, I just find it's been really cool. My caseload's kind of been shifting more that way too. We're kind of getting like the clients who, I hate to say, like fall through the cracks at like a regular physio model. They need more one-on-one or more education, or they need a different mode of kind of treatment. So we kind of, Dani, I joke, we kind of get like people who don't fit into the other clinics. We tend to love, those are our people, like who want to try something different. They want to try a different approach to movement, and they're like motivated to change their kind of connection to movement. So we get a lot of the, I've tried everything people. And we love that because they're usually so motivated to try Pilates. So like I said, everyone can benefit from it. We tend to really love our chronic pain patients and clientele, but we still love our dancers and high-level movers too.
Yeah, I imagine it gives you a lot of variety in your job. Even though you're using Pilates, it's a completely different experience if it's somebody who has a huge fear of movement and doesn't want to bend down to touch their toes versus the dancer who's training for like a high-level competition, right?
Exactly. And the other kind of cool thing that the Clinical Pilates can offer is, and we're getting more of this in our caseload as well, are patients who are looking for preventative physio, not just like reactive physio, if you will. So people come in like, I have nothing wrong, I'm no pain, I want to make sure to prevent injury. And people come in for maintenance, which is also kind of a different spin on physio, because I think physio assumes like everyone assumes you have to be injured to go to physio. And it's like, no, like movement is medicine, like regardless, so just come in and we can get people moving. So that's been kind of a different thing too, because if you think of a regular physio model, goats, if someone comes in with no injuries, it's like, what do you do to assess them? Because we know as physios, we learn special tests, so we learn strength testing. But if someone comes in fully healthy, like where do you start? And I think Clinical Pilates is a really cool way to do that because it teases out movement patterns, little things that you might not notice.
Yeah, absolutely. That's very interesting. Super cool.
Yeah.
Yeah. And I'm thinking about the chronic pain stuff you're saying too, because obviously that's my specialty. And you just saying that they move in a novel way that's different. So much of chronic pain is really finding safety in the nervous system. So that makes complete sense to me. If it's just a new movement that they feel safe doing, then exactly kind of, quote unquote, tricks the nervous system to believe that the body is safe doing that movement. And then you kind of have that as like, hey, look what you did. And which is always amazing, right? People benefit a lot from that.
Well, and it's like, you find the win. It's fun. They're almost like sometimes surprised. They're like, I did that. Like, this is what happened. And yeah, like you mentioned, that safety component, it's like retraining what the body knows is safe, which I just think it's been so cool to see for all of our clients is like that response of retraining safety has been huge.
Mm-hmm. And something that I find with yoga as well, which you mentioned with Pilates, is finding that connection back to the body. It can be so hard when you have an injury or mental health issues, or even, I think, eating disorders. Obviously, that's not my specialty, but things like that, where you're just so disconnected from intuitively noticing what's happening in your body. I find that yoga is a really good modality for that. And it sounds like Pilates is as well.
Absolutely. Yeah. Big on like breathing, the connection. And it's also big on like not pushing to your max effort. Like I know there's so many variations on Pilates and yoga for that, but it's like, no, like just move how you can move. We'll make this work for you. And I think that's so important for anyone, but particularly chronic pain stuff.
Yeah, for sure. What are the biggest benefits that you see clinical Pilates having for your patients, or what do patients say to you? I know we've touched on a few, but yeah, what are the biggest things you see?
I think honestly, the biggest one, I have touched on this, is just getting people to move. Like everyone's instinct when they get injured is, oh, I have to rest. I shouldn't do this. This is what hurts me. And I think in integration with Pilates is that pain education of like, no, pain does not necessarily mean there's a sign of damage. It's your body's way to protect you. So it like integrates into that. It's like that nervous system retraining, getting them moving can retrain their body to that safety retraining, and also just like let them know it's okay. It is okay to move. The body is safe. You'll be all right. And so I think it's like creating that independence for that patient of like, okay, no, you can do this, giving that reassurance and showing them the win. Like, yeah, this is going to work. See how you did that compared to last week. And it really motivates them, gives them that, well, ties in beautifully, the empowerment of like being able to kind of do what they want to do and do what they need to do without worrying about their body or their symptoms that they're having. So honestly, the biggest one is movement. I think the second one would be surprising themselves has been a huge benefit. And then the other one, which maybe I haven't mentioned, is just the way that Pilates can integrate modified weight bearing. So, for clients who are at a fall risk, maybe it's post-stroke or some sort of whatever condition it is that doesn't make them safe to do standard, squats, calf raises, stairs, all of those things that would be more risky. But there's a lot that can be done in like a laying down position, modified weight bearing position, and the springs of the equipment can either support or resist a motion. And we get creative. Like we love the creativity of like workshopping. Okay, that definitely didn't work. What can we do to sort of make this happen for this client? And so it's a really cool way to support or resist, and you can kind of modify that throughout your sessions to make it work that day. And I think that's really cool for patients because I feel like when they're not ready for exercise in a classical sense, it holds them back from participating in their life and in activities. So I think it's just great to have a way to get them to do something, whether they're in a flare, they have chronic pain, whatever that is. So yeah, it's just that movement piece is huge.
Yeah, that's such an important thing to be able to have that variety and get people back to moving. So that's really great that you see that as a benefit and that your patients have seen that as a benefit. That's awesome.
Yeah, for sure.
Is there anything else about clinical Pilates that we haven't touched on that you would love for the listeners to know?
I feel like you've had some great questions. So no, I think we covered quite a bit. I think the biggest, like I said, the myths, if you will, about Pilates, which we've touched on, is just that it's not just for women and it's not just for dancers. Like it's for everyone. If you don't think you can, trust me, you can. We can make it work for anybody. We've had such a wide variety of patients and abilities. So like I said, the Pilates classes, maybe if that's not individualized enough or modified enough for you, clinical Pilates is a really, really great opportunity. So I don't know if any healthcare practitioners are curious about clinical Pilates. I'd say you can always check out our website for that too. The clinical Pilates course, we've run it a couple times now, beginner, intermediate, and advanced levels. And it's just I'm biased, but it's a pretty great way to kind of modify your practice and give you some different treatment options. I encourage everyone to try clinical Pilates.
Yeah, listening to you talk right now, it's making me want to come do the course. So maybe...
Oh, I would love to come see you. Please. I was going to say you just come to Alberta and visit me, but if you want to come do the course, that's even better.
Yeah. A little bit of both.
Yeah, a little bit of both.
Yeah, for the listeners who don't know, a little background story is that Leah and I lived together in physio school with three other girls.
There's 5 of us. Yeah,
in a house. And it was the best of times and the most stressful of times.
Yeah. But we obviously made it out alive and still like each other. So that's a good sign.
Yes, absolutely. Before we leave today, I would love to ask you the 2 questions that I ask everybody on the podcast. The first one being, what is one book you've read recently or a podcast you've listened to recently that has educated you on your health that you would like to share with the listeners?
Yeah, so there's a couple that I've been recently diving into. I've been in course mode lately, so I feel like I haven't had as much podcast free time. But The ones I've sort of started dipping my toe into a little more so, one is called Bendy Bodies with the Hypermobility MD, Linda Bluestein. It's about a variety of topics, but I also have a particular interest in like hypermobility chronic conditions. And I've listened to a couple so far, and I just find the way that they cover like Ehlers-Danlos, hypermobility, and all the stuff that goes with it is really cool. There's a mix of like dance physio stuff and then like regular human stuff too. But there's a lot of variety in that. And so I think that's a really cool resource. And then this one just largely, or the other one I have is largely for like pain education. And I just like reference him all the time for clients, and he has podcasts, so why not? Lorimer Mosley podcast, Pain Matters. If you really want to nerd out about pain, which I love to do, is really cool. And of course, all of those resources for clients that he has are phenomenal as well. So I just think it's important for pain education in general. Those would be kind of the two that came to mind.
I will definitely have to check out the first one because I've never heard of that. Lorimer Mosley's like, I don't want to say pioneer of pain science, but he's definitely very well known in the pain science world. So
I'm okay saying pioneer. That's just like, you can like fangirl about pain science for that. Yeah, for sure. But no, the Bendy Bodies one, I think I came across that more through the dance world, like going to dance conferences, and you kind of hear about these people, and that's how I stumbled across it. But I think there's a lot of other great information in there just for hypermobility, because hypermobility is not just for dancers. So there's a lot of people it applies to.
Yeah, for sure. And then the last question I always like to ask is, what does empowered health mean to you?
Yeah, it's so hard to like break it down in a simple answer. So this is like a great question. But I think like the key essence would be to have someone who can actively engage in their health decisions so that they can basically like optimally participate in their life. It's giving them the freedom to do what works for them so that they can live their life how they want to live according to what's important to them. And so I feel like there's a couple components that tie into that, but understanding your health is a big one, like having that education information actually presented to you and being able to ask questions, having a team that puts your interests first, being able to know how to manage your symptoms, like an off switch or like kind of a reset button for when you're having flares, or what can you do? So I just feel like the education piece and the decision-making piece is so critical for that. And being able to have a say in what works for you, because only you know your body best. Like physios, and we can help give suggestions, but ultimately it's the person who should be able to decide what works for them. So yeah, I think just being heard, making educated choices, and choosing what works for you.
Yeah, I really like that. And it's so true. I find a lot of people come to clinic and often say, well, you're the expert, like just tell me what to do. And I love when people have that empowerment and understand that, yes, we have the schooling, but really we're not living in that person's body. And you are allowed to advocate for yourself and say, like, I don't like this, or this isn't working for me, or I want a second opinion. If they're a good practitioner, they're not going to be offended, and they're going to be happy to get a second opinion, right? So
totally. And like we learn from that as practitioners too, because every client is so different. Mm-hmm. But yeah, patients know their body best. And like, it is kind of interesting when you have to like you're presenting the info and you're like, I want you to make a choice. And some patients aren't used to that. Mm-hmm. So that's always an interesting thing too, to be like, it's okay for you to pick. Like you can choose, we'll try this out. It's like, I even have that conversation with clients, and like, this could take some trial and error. Because I have some clients who don't respond to exercise typically, whether it's like POTS or, some different presentations, I guess. And I'll be like, hey, here's the honest truth. This is what could happen. This is what could happen. We're going to trial and error. You're going to show me kind of what works for you. And I think when you see their face, it's kind of like, oh, yeah, we can do that together. I think it's just a kind of a cool level to work on it with the client. And it really helps to create, I don't know, I feel like they feel supported and they understand that they're heard. I think that's super critical.
Yeah, for sure. Even me as a patient, like I love when I'm given options and choices and not just told like this is the only thing that is going to help you. Because often there is a variety of things that are helpful.
Yeah. Oh, exactly.
Yeah. Well, thank you so much for coming on the podcast. I learned a lot about Clinical Pilates. You're making me want to come do the course, and hopefully other people learned about it. I know you're in Calgary. Your clinic is in Calgary. I'm based in British Columbia. I don't know if you know of any clinics around Canada or potentially in the States. Maybe you know all of them that use Clinical Pilates, or maybe you don't.
Yeah, well, Clinical Pilates is funny too, because there's some people who use Pilates and like call it Clinical Pilates. I guess to say the Indepth Clinical Pilates model, we've had some people, we currently have someone who's taking it. They live in northern BC. So you can also check out our website. They have sort of a list of past grads who've taken our course. So it's easy for people to find in their area. But we've had some in Ontario. We've had a couple in BC, Lethbridge, Edmonton. I think those are the main ones so far. But so yeah, there's a couple different clinics, but the easiest way to look would be like at our website just to see past grads and kind of connecting that way. But you can also just, if you have a clinic near you that does clinical Pilates, you can always check to see, did they do our Pilates? Did they do a different kind of Pilates? Does that style work for you? Like kind of just make sure it's the right fit for you, I think is the big thing. Because I think Pilates is more popular now, so it is becoming a bit more accessible.
Yeah, absolutely. And before you go, since you mentioned the clinic, is there any way that we can get in touch with you if people want to learn more about Pilates? You can share that and I'll put it in the show notes.
Yeah, sure. So for me directly, email is always easy. So it's Leah, Leah, at indepthphysio.com. And my Instagram is just physioleah, all one word. And then in terms of the clinic, like I said, we're at Indepth Physio in Calgary, Alberta. So our website is just indepthphysio.com. Straightforward. And then the Instagram for the clinic is indepth.physio. So we have usually some videos and Pilates stuff and different education that pops up on there. So you can definitely check us out.
Amazing. Thank you so much for all the excellent information. And I know I learned a lot. I know other people are going to learn a lot. So thanks for coming on.
Oh, thanks for having me. As you can tell, I love this stuff. So I'll talk about it any day.
Amazing. Maybe we'll have you back on.
Love it. Yeah.
Okay. Bye.
Thanks.
Thank you so much for listening to this episode of Health Empowered. To support the show, please rate, review, share, and subscribe. And if you're looking for support on your health journey, visit my website, empoweredmovement.ca. Have a great day and stay empowered on your health journey.